Anthony Dale, CEO of Ontario Hospitals Association. Anthony, thank you so much for joining us this afternoon.
You're welcome.
All right, so first let's talk about what do you make of the hospital bed situation in Ontario?
Well, the situation is incredibly worrying. Everyone watching today should be thinking very hard about how they can take steps to be part of the solution and prevent the spread of COVID-19. You know, I heard you in your opening suggest that we were still below 300 patients with COVID in intensive care. There's different measurements that are published for intensive care occupancy. And the overnight census actually for last night suggests that we are actually now at 304 patients with COVID-related conditions in Ontario hospitals. So that's about a doubling of intensive care occupancy in 4 weeks. So the situation in January could be extremely serious indeed. All
right, so knowing what you know, are hospitals in a position to handle the capacity of patients you're seeing right now?
No. It's very important that everyone understand that what's going on in hospitals now is not anything at all that's close to normal. There's a certain fixed number of healthcare professionals and workers, and they are also doing, in addition to their normal activities, they're running all those testing assessment centers, the labs that are running 24/7. An incredibly high number of them are supporting long-term care facilities. And of course, hospitals are now part of the vaccine distribution program. So the amount of pressure that's being placed on hospitals because of increasing numbers of COVID-19 patients and in intensive care is totally unsustainable. To get to high-quality care in intensive care, you need specialized physicians, specialized registered nurses, respiratory therapists, and so on. And we don't have an infinite number of them. We can adapt and change and evolve. Certain kind of tactics can kind of enhance some of that human resources capacity. But if we're looking at 500, 600, 700 people in intensive care in January, and God forbid the outer limit of the modeling that the province released last week, I would imagine the hospital system will essentially find itself in an enormous crisis.
Absolutely. And we've been hearing about hospitals having to postpone elective surgeries. What can you tell us about that?
Well, elective is a kind of benign term because it almost sounds like it's optional. But all it means really is that the surgery can be scheduled, but it can be urgent and also necessary to save life. So that means cancer surgeries are being canceled, cardiac surgeries being canceled or postponed. And you know, the London Health Sciences Centre has been grappling with a very difficult outbreak for weeks now. It's one of the province's few organ transplant programs, and that organ transplant program has been highly disrupted because of it. So this situation is extremely serious. I don't know how to say it other than that people really have to take responsibility. We're really begging you to not gather over the holidays, to stay at home, to practice physical distancing, to wash your hands, and we can bend down this COVID curve. If we don't, the consequences are going to shock you.
And we're almost out of time, Anthony, but tell me, what more do frontline workers and hospitals need as the numbers continue to climb?
Look at people who work in healthcare on the front line. They got into this work because they have a passion to help people, but they're very, very, very tired. They're emotionally and physically exhausted. And so they're asking for your help. And that's why yesterday, the hospitals of Ontario, along with the nurses of Ontario, the physicians of Ontario, respiratory therapists, and the lab professionals all put out a single common unified statement calling on not only thanking those frontline healthcare workers for their enormous sacrifice, because they are working this holiday period when many of us are not, and really on their behalf saying respect their sacrifice and please stay home if you can.
All right, well, thank you so much for that. That is Anthony Dale, CEO of Ontario Hospitals Association. Thanks again for your time.
You're welcome.